Percent tariffs on Chinese imports started today. There's a dire warning when it comes from the medical industry and the drugs we take. Health experts say there's concern it could drive up the cost of generic drugs in the U.S. and possibly cause shortages. China plays a big role in manufacturing generic drugs, which account for about 90% of all prescriptions filled. Two big questions really tonight on the minds of many families as they sit down to have some dinner this evening. How much more will generic drugs cost, and will these lead to more severe shortages? Channel 8's Emma Norwood is live explaining how this could impact your family's health. Emma?
Thanks, Rod. I'm at Nebraska LTC, where the pharmacist tells me these tariffs could be very costly for drugstores and possibly for you.
According to Harvard Medical School, about half of the generic drugs taken in the U.S. are made entirely overseas. This includes cancer drugs, antibiotics, and blood thinners. And around 80% of the APIs, or active pharmaceutical ingredients, used in drugs come from other countries. With China having about 219 of these API manufacturing facilities, the tariff could lead to shortages. Amanda DeGrave, a certified pharmacy technician at Nebraska LTC Pharmacy, tells me this hurts the bottom line of pharmacies.
The reimbursement rates are already very low for generic medications. I don't, with the expected increase in pricing of medications, I don't feel that the reimbursement from insurance companies is going to match that. So we're going to be reimbursed the same rates from the insurance companies, but the medications to actually purchase to be able to provide them are going to cost us a lot more.
She says the main concern of the pharmacy is always the patient, but with the shortages, it could mean they can't fulfill every prescription.
Our concern is being able to provide the medications that have been prescribed for our patients and not having access to them or having to pay a considerable amount, a higher amount in order to be able to get those and keep them in stock.
In order to prevent higher costs, experts say some hospitals may start stockpiling drugs. We asked if you were concerned about this issue on our Now Local News app. Citizen journalist Naveen says she didn't realize how many drugs are made in China.
I am on medication, and it's not, unless you have really good insurance, private insurance, or if you have Medicaid, it can be very costly.
Citizen journalist Kevin says this is going to impact everyone's wallet heavily.
It's going to cause a lot of problems and a lot of headaches for people that's trying to be healthy and stay healthy and to get better.
DeGrave says if you have private insurance, it will cover most of any price increase. But if you have Medicaid or no insurance at all, you will be paying a lot more out of pocket. Reporting live in Lincoln, Emma Norwood, Channel 8 News.
All right. Thank you, Emma.